Hi guys, today we're talking about knee pain, ankle pain, and obviously foot stability as well, and linking it back to the hips. So following on from the premise of what we used last time when talking about the fact that when people get a lot of neck pain and they get headaches, that it's not actually directly related to what's going on here, it was more from the pulling from here. We're going to use that premise and show how ankle stability and arch support and knee pain is actually directly related to what the hips are doing. So the legs next to me are actually from our exercise physiologist, Tiara, and her legs are actually going to show us how activating your external rotators of your hips, so externally rotating the head of the femur in the hip capsule, can directly affect your knees and how load will be distributed around your knee and through the muscles through here, and also how your arches are supported. So no matter what age you are, whether you're a kid or whether you're a parent, obviously trying to look after your child, whether you're going through sport as an adolescent, whether you're in the peak of your career, or you're transitioning sports, you just want to run a lot as well, things like that, or whether you're actually just trying to keep yourself out of pain just to do the things you want to do on a day-to-day basis, this is very, very important. So what you'll notice now, obviously the focus point here are the knees. Okay, so you'll notice that there's a little bit of internal rotation. They tend to point inwards a little bit on both sides, okay? And you'll notice that these arches, well, let's just call them flat to keep it simple, or flattish. So you find yourself or someone that you care about in a little bit of pain. It may be at the ankles or the feet, the arches maybe, it may be at the knees. And you go, okay, so what's actually causing this? So a lot of the time you may get some arch support shoes, you may get some orthotics or insoles just to support that arch, okay? So a very, very simple tool to make sure your muscles are actually operating effectively to control this instead of just putting your foot and your bone structure in a certain position. Definitely not saying that's a bad thing, but of course you want to assist that process with turning your muscles on so it can assist the foot really activating properly and the muscles around it to work effectively. So as I said before, you'll notice that Tiara's feet are relatively flat, the knees are kind of pointing inwards, okay? So it's a very, very simple tool. What we're going to do is externally rotate from the head of the femur, so we're actually using the glutes and the external rotators of the hip to actually put the arches and the knees in a more stable and supported position very, very quickly. So what you're actually going to do if you want to do this at home, say your feet are here, you're actually just going to try and twist the feet out, but don't actually let them go anywhere, okay? So you're just turning on the hip to actually do that little bit of a turn. So Tiara's going to do it now. And you notice how the arches just come up, they're quite supported, the knees are now in line, the glutes are actually operating quite safely and in conjunction with the muscles through here to make sure that distribution of weight, whether you're running, whether you're squatting, whether you're lunging, whether you're doing anything, to make sure that that is obviously distributed evenly, and also the arches are supported there as well. And that's all just come from a very, very simple tweak or a very, very simple fix through here. So now I'm going to show you exactly the position that Tiara's in now and how it can affect a movement so basic as a squat. So Tiara right now is going to squat, and I want you to watch her arches and her feet, her ankles as well, and especially her knees. Go for it, T. So what you would have noticed there is the internal translation through here, a bit more flattening, the knees going in as well, and that's all I really want you to focus on. So what we're going to do is pre-cue the movement just with that minor amount of external rotation, and I want you to see the changes in the exact same places. Go for it. You see that? All good. So I'm in no way saying that this will cure all of your pain, whether it's at your arches, your ankles, or your knees. I'm just saying it may be stage one to actually make you a little bit more stable through your movements, maybe reduce ongoing pain, and actually make you a little bit more efficient with whatever movements you're doing. If you want a little bit more, feel free to contact us. Talk to you soon. Bye.